right now.
The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. My name is Eric Depew, and it's my honor this afternoon to present Laura Conrad in our demonstration of MyShapers. Laura is a dynamic speaker committed to the education in the obesity of children world, and she's got a wonderful story to tell. She is the president and founder, or CEO and founder of MyShapers, and I will turn it over to her ASAP so we can give you some of your hour back if you so desire. Questions can be on the right-hand side of the login screen. When you logged in, there's a question and answer box at the bottom, and we'll take questions at the appropriate time and try to be cognizant that you've committed your time to us today. Laura, if you would, go ahead and let's start the presentation.
Well, thank you very much, Eric Depew. We appreciate you hosting this for the MyShapers program and being committed to making a difference in the healthcare yourself. Good morning. It's still morning time here in California, and thank you for joining our live webinar. And MyShapers.com is here for the youth to learn better eating, better fitness. We're a true nutrition program, and we are literally one of the first weight management programs in all the settings of healthcare. And we're now positioned and designed to partner with your organization. We're more than just an excellent program. We're here as an engaging health IT tool for you, 24/7, 365, and that's the beauty of it. Our mission is to empower you, the healthcare provider, whether you're an employer group, a direct provider, you're in a public health setting, organization, and parents. We are here for each and every one of you to help inspire a lifetime of healthier eating and activity for children, specifically for ages 6 to 11, and the parents. It's a child-parent program together. Now today, MyShapers is a complete 6-week program online, and we use music, interactive tools. It is a home-based or a school-based activity, and the kids will be able to log in at school or on their smartphone, the parent's smartphone, and the parents as well. So whether you're on a tablet, on a laptop, or on a smartphone, you're able to get logged in immediately and sign up within 5 minutes. That's the beauty of it. There's no staffing needed. The Better Eating and Better Activity program, it's self-paced. So we're teaching behavior modification, nutrition education, and activity management. Our executive team has more than 100 years. It's close to 130 years of combined experience. I'm Laura Conrad, the founder. Dr. Farshad Fani Marvasi, he likes to go by Dr. Shad, is our chief medical officer. He is a nutrition expert at the College of Medicine for the University of Arizona. Ken Rivers, Keith Wakeman, Keith Radley, and Mark Kandersatz are all on our board of advisors and take a leadership role in the company. Our value is multi-level. It is multifaceted, I should say. We have an online platform. The program management is complete in and of itself. We provide you registration, implementation, the evaluations, and all the administrative feedback. So you'll know completion rate, success rate of the program. And our entire team, our professional team of management comes with the online platform. So we're helping you, the health plan, physician groups, wellness programs, individuals reduce chronic disease. And that's the key. Reduce and prevent chronic disease in an effective and engaging methodology. We hear just raving reviews. Kids are loving the program. So these statistics are astonishing. Just in the US alone, 8 million children ages 6 to 11 are chronically obese. That's out of control. We can do better. And that's why we're all here to fight childhood obesity today, together. And when we work together collaboratively, strategically, through partnerships, we can evoke change. 80% of obese children will be obese 25-year-olds. We need not wonder how we're getting to such high rates of diabetes, high blood pressure. We know that obese children will be 40% more likely to have diabetes as an adult. And now pre-diabetes is becoming a huge factor, because if we can catch it at the pre-diabetes stage and reverse it, then the ravaging effects on children of type 2 diabetes is prevented. We've got to prevent the full-blown type 2 diabetes whenever possible. So obese children will grow up to be adults at risk for diabetes, heart disease, stroke, various different cancer, osteoarthritis. Now, our approach is evidence-based. We want you to have confidence. It's a safe program. We help behavioral modification through an evidence-based approach. We go through the stages of change so that they can begin to think about what is a positive habit. And then they can have a pre-contemplation of thinking, wow, what if I did this? And then actually doing it. So the 6-week program is controlled. And that is the beauty of it. The kids have fun while they're doing it. So they don't know, oh, this is what they're helping me behaviorally do. They're just knowing, oh, I like doing this and this feels good. And that's important, because the self-esteem, improved self-esteem in our program, and we're going to talk about the statistics a little more, but it's more than 91% of improved self-esteem of the children who finished our program. And that's because of the behavioral modification. They give themselves the mental credit. The nutrition education is foundational. It sticks with them the rest of their life. They're going to know the food groups. What are high nutrient-dense foods in those food groups? So this works for the individual. We also work as an enterprise, a network, and the providers themselves. So we have a complete comprehensive approach. Going to the middle, our product and services, our online platform is key. The fact that you don't have to have staffing to register the patients. You don't need staffing to confirm that a class is coming up. You don't need to have a conference room, have security, have housekeeping set up the room. All of the materials management. You don't need to print materials, have it made. It's completely done in and of itself. So if any of you personally have done programs, offering programs, you understand the labor intensity. And then what? Classes get canceled if you don't get enough enrollment. So people get disappointed. This is avoided. If you have a program right now that you currently are offering and people can't take it, this is a great solution. If you have a program right now that you're offering and you need to augment a supportive educational platform at home, this is MyShapers' opportunity to help you, as well as people are wanting to offer this as an ongoing support tool after a program that they are offering. So we help work and fill in the gaps for you. The online platform is designed to help you, the healthcare provider, provide the best services to your patients. Moving, and again, it's for the children and the parents. Moving on to our company, we have 22 years experience behind this program. This is not just a platform that was made. We have offered the program all throughout Northern California. We literally were one of the first, if not the first vendor Kaiser Permanente ever offered, and they are a well-known risk-based payer. They need to control their costs, but we had more than 30 Kaisers, HealthNet, Hills Physician, Blue Shield, and many different employer groups and schools. So the program has been a great success, but what happens, we need to be able to replicate this, have quality control, and have accessibility higher. That's why it's now online. The children and the parents get to take it together immediately. It's user-friendly. It just literally fits in the palm of their hand. Whether they're in an exam room, they're there at home, they get an email, they click on the link, they sign up. It's mobile responsive. So have you ever gone to a website where you can't quite read the font and you can't see, but you go to your laptop or your LAN computer and you can see the website? So that is called a non-mobile responsive website. So ours is mobile responsive. Whether you're on a cell phone, a laptop, or at home, It's easy to read and easy to navigate. That's extremely important for the user friendliness. The kids love it. The interactive platform makes it engaging for the kids. It's like a game for them when we're seeing if they understood which foods go into food groups. For them, they're dragging and dropping fruits into a food group and the grains into the other food group and identifying nutrients. And they are having a game-like effect and having fun with some music. And I've just recently have been told that it's like as if they're taking the class with you, the way we designed it. So people are excited about this. We make it fun for the kids, and they practice the home activities every single day based on what they learned. So there's a parent note and a child contract each and every week. And I will give a quick demo of the website. And if you'd like a longer demo in the future, let's talk. I'd be happy to go through a little more in detail on the curriculum with you or any questions that you may have. Now, here is the website. It's kid-friendly. It is engaging for them. We have lively characters. We have animated fruits and vegetables to bring the nutrition and the fitness to come to life. So let me show you quickly how organized the website is. The patient will come in to sign up. They will fill out a bit of information and immediately log in after that. They will have access to lesson 1 for the first week, and they will go into whether they're 6 to 8 or there's a 9 to 11-year-old. So when they sign up, they're going to choose if their child is 6 to 8 or 9 to 11, and we always suggest if the patient is going to become 9 years old, age up, always go for the older one. So 9 to 11 will be fine. I'm going to click on the test course and show you how easy it is for the kids to use. Literally, lesson 1, they click on it, they can't access any of the other lessons, and the entire curriculum titles are listed here to the left, and also we have a navigation on the right. For example, there are a series of videos, and then there's a quiz afterward. Let's look at the Gotta Love Those Vegetables. Let's click on that video. I'm jumping to lesson 1, video 6. Okay. So it's a powerhouse of vitamins. When we're choosing vegetables, we need a variety. You may not be able to hear it right now, but what we have is lively, engaging videos. After they watch this video, this one is a longer one, about 4 minutes long. Then they will go to the quiz. Lesson 1, video 6, vegetables. So we'll click on it. They can't go to the next lesson without clicking on it. So which vegetables have the most vitamins and nutrition? Vegetables with dark colors, vegetables that are round shaped, or vegetables that taste sweet? Let's say we answer the wrong question. Let's say all vegetables that are round shaped. Let's see what happens. Are we going to shame them, make them feel stupid? No. We just let them know, oh, green is the vegetables with dark colors, and we give a light, soft red, just letting them know this is not the correct. So when they finish the quiz, they get points, and it accumulates, and we'll get a score at the end. They can either restart the quiz and do it again, or click here to continue. It is extremely easy for the children and the parents to navigate. These check marks above also click to the videos. We get the kids having fun, and then there is home activities for them to do. They need to know how to do it. So they will have a food chart and an activity chart. We want them paying attention to every 5 minutes of activities and acknowledging their fitness. This creates a full continuity care back to the patient and the administrator, so you understand that it's not just learning the information, but it's applying the information as well. All right, let's get back to my presentation here. And I might have gotten out of it. I might have blown that. Sorry, everyone. I'm going to push play and get myself back on track here. I know there was a smoother way to do it, and I didn't do it. All right, the pediatric platform, as you see, it works for your patients and the parents together. It works smart for institutions alike, as I've mentioned it. So our intelligent technology routes the communication such as pre and post nutrition knowledge test, BMI, and some of the user analytics depending on what information you want from them. We are constantly updating and upgrading our website. So the PDF files are literally being coded as we speak, and they are going, the upgrades automatically get built in, and there's no additional charge for the upgrades. And the kids will have an interactive charting here very soon. So we're excited that we're continuing to make the program even more dynamic. So we deliver the analytics. The program is complete in and of itself. If you'd like to have this on your website in a non-invasive technology, our tech team and your tech team, we can work together and we can do some, put your logo on the site and make sure that it's a full a presentation in a seamless way to refer patients to our program. So we can do some wonderful, just provide extra resources for your families, the families in your communities. And it's a great community outreach tool. You can add another tab, adolescent health, nutrition education, activity, family programs. This checks off a lot of boxes. So our mission forward is to reduce and prevent childhood obesity, which is what's going to prevent diseases. Families, we know, are impacted by tragic obesity-related diseases. The nation is impacted because of the huge economic and social toll. We know this is impacting our children's physical, mental, emotional health, and we can create an opportunity for them to have a difference today. We don't need to wait any longer. The program's available and it's ready to go. We can reduce this, these astronomical numbers. Look at this. According to the CDC, the medical costs of obesity are estimated to be as high as $80 billion. And the ROI model that we see, the return on investment for offering MyShapers, is up in the 77,000% return on investment. It's a minimum at a 2-year mark. So it is a small investment for a huge payoff. It helps control disease and risk, and it empowers your patients immediately. There's very little effective content out right now that's available. And that's why MyShapers is imperative to have it available for your patients immediately. Professionals need solutions. Families need solutions. Here's the top 3 reasons why physicians, employer groups, public health professionals lack a kid-centered, broad-reaching program. Because adult weight loss solutions aren't safe for kids nor engaging. And you even hear these programs that for children, they say, oh, it's not a diet. Well, they're giving you a diet. They may say they're not a diet, but we're putting kids on diets. Diets don't work for adults. They don't work for children either. The only thing that works is nutrition education, behavior modification. We must inspire and motivate them and empower them and help them understand the direct cause and effect. And when they feel the physical difference, this is affirming to them that, yes, I can make myself feel better by moving more and eating healthier and telling myself positive things. So we cannot impose adult weight loss, quote unquote, solutions for kids. It's not safe, it's not engaging, it's certainly not sustainable, neither for teens, and as well as there's no scalable solution for the multicultural targets. And we right now are slated to offer the children's program in Spanish. We used to offer it when we were on site, and again, we are planning to offer it again. The report on our program in the past shows an astronomical impact, 6 to 12 months post-intervention by a third party who did a study on our program. And the program was done on, the study was done on children and teens, and we're looking at a summary of behavioral changes made by the parents 6 to 12 months post-intervention. This is just a 6-week program. They had to go to their local hospital. These are low-income families even, were Medi-Cal patients. So the parents reported 92.3% of them provided more fruits and vegetables for their kids. They reported they're doing it 6 to 12 months post-intervention. 87% said they're purchasing less fast food. 66.7% limiting the time watching TV, and 46% exercise with their child more. These are phenomenal results. We're looking to replicate this online, and I'm going to talk to you about the study that we are starting right now. The parents reported on their child 6 to 12 months post-intervention. This, again, is on our program that was on site, and we're looking to replicate these same results, if not even better, online and in a larger scale as well because of this accessibility. So the parents reported their child, 88.2% of the kids, of their children have increased their physical activity. 76.9% of their children are eating less fat. And you know it was solid fats, trans fatty acids. 73.1% are eating more fruits and vegetables. That's phenomenal in and of itself. And 69.2% have improved their diet overall. This program is more than double the results of what most programs have and are what considered effective. Now, the program, it does create a lifelong healthy habit. The program is complete in and of itself. There is no staffing needed. You don't need anyone to register or teach the program or cancel it. We need to set up a strong referral system and a screening system for you to be able to offer the program. If you currently have one in place, we will work within your framework to provide and leverage the opportunity for the families to benefit from this. It's engaging, it's self-paced, it's focused on the behavior modification. And again, we want the parent and the child to take the program together. So we've built all this into this wellness utility. Okay, so we have just about concluded here. I'd like to answer any questions. We've done a quick little demo, but we would like to align with your organization and to be able to offer a complete comprehensive care, whether it's clinical, inpatient, or outpatient. We can provide you some relevant data to be able to substantiate offering this year after year so that your community can depend on this as an effective tool and your providers as well. Now, any questions that we have right now? How are we doing on time here?
We're doing great on time. Laura, you've actually done a great job. You don't have any questions. And,
okay.
So at this time, I'd say if you do have questions that come up, please take her information down that you see on the screen there. Laura will be glad, or somebody on her staff will be glad to get back to you. And we look forward to any follow-up demos that you may request for you and your staff. Laura, thank you very much, and y'all have a great day. Bye-bye.